According to the World Health Organization, 1 in 4 people will experience mental health or neurological difficulties at least once in their lifetime. One common concern of patients and relatives when it comes to starting psychiatric medications is whether it will cause dependence. The answer is no, and the majority of drugs used to treat psychiatric illnesses do not have abusive potential. To understand this better, one needs to know how psychiatric medicines work and what is meant by dependence. According to the World Health Organization, any substance can cause dependence if increased quantities of it are required over time to produce the desired effect. For example, alcohol can cause addiction because, in some individuals who drink, it may build tolerance over time, requiring more quantities of alcohol to bring about the initial kick. Over time, an alcoholic may need increased amounts to experience the desired effect, leading to uncontrolled drinking and addiction. On the other hand, psychiatric medicines are started at lower doses and gradually increased if required by the clinician until the therapeutic effect is reached, after which further increase in dose is not necessary. Once the optimal therapeutic response is achieved, the patient will be maintained on the same dose until there is the full remission of symptoms. After this, the medicines can be tapered and stopped if necessary. Another feature of addiction is the craving for procuring the substance and lack of control over its use. For example, nicotine can cause an irresistible urge to smoke, resulting in craving, and the individual is unable to resist the impulse to smoke. On the other hand, psychiatric medications used therapeutically do not cause craving, and sometimes patients may even forget taking them on time. Now let us try to understand how psychiatric medicines work. Our emotions are regulated by chemicals within the brain called neurotransmitters. If there is an imbalance in these neurotransmitter levels, the person may have trouble managing his emotions. Psychiatric medicines work by correcting these neurochemical imbalances in the brain. For example, serotonin is the happiness chemical in the brain. If the levels of serotonin are low, people cannot perceive happiness, and this will result in a pervasive emotional state of sadness leading to depression. Antidepressants act through correcting this imbalance by increasing the serotonin availability for neurons. Hence depression is reversed, and the patient will be able to perceive happiness as before. Stopping the antidepressant will cause the levels of these happiness chemicals to fall again, resulting in the recurrence of depression. Such patients may benefit from continued medication to maintain the neurochemical balance. This, however, does not mean that they are addicted to medicines. Instead, the medicines were effective in supporting the neurochemical imbalance, which was present at the onset of depression. It can be compared to prescription glasses advised for correcting refractory errors. When the individual stops using the glasses, the eyes are left without any correction, and the vision drops to previous levels. It makes the person wanting to use their glasses again. It does not mean that the individual is addicted to their glasses. Rather, it proves that the glasses supported the eyes better by correcting the refractory error that had already set in. Similarly, psychiatric medications correct neurotransmitter levels inside brain and are not addictive. In short, psychiatric medicines do not require increasing dose infinitely and cannot cause dependence. They can be gradually tapered and stopped in patients who recover and act by correcting the chemical imbalance within the brain. Hence it does not cause addiction. Please consider subscribing this channel for more informative videos related to psychology, mental health, and parenting.